So we are discussing pathologies of pathology, not sorry, hepatobiliary radiology. So in the radiology, first we have to discuss pathologies. Okay, so today we will discuss about different pathologies of hepatobiliary. Hepatobiliary in we will get two organs and one duct. One is liver and another organ is gallbladder, and they have common duct or liver will produce the bile. So it have the liver duct, then it will combine with gallbladder. Both will become common bile duct. Okay, already studied in anatomy and physiology. Basically, what are the common or common pathologies will occur in the liver? Okay, so we have to know that liver have two blood supplies. Okay, liver have two blood supplies. One is portal vein and hepatic artery. In that, large amount of blood supply is given through portal vein, that is 60 to 70%, and hepatic artery it will give 30 to 40%. Okay, 40 to 32%. So in the radiology we have to diagnose the liver damage or liver pathology. So initially we can advise the ultrasound abdomen. Okay, it's okay, but the investigation of choice for liver tumor, liver abscess, or cyst. Okay, all these types of diseases needs a special type of scan. We will call TPCT. Okay, TPCT. So let's see that TPCT. I will show you that TPCT. Okay, it is a triphasic CT. Triphasic CT. So in that, the we can see that it is the triphasic PG, TPCT or TPMRI. So it is a special type of scan which to be done to see the triphase. Triphase means circulation. Okay, within the circulation, portal circulation, or before portal circulation, or after circulation, or within the circulation. All this to be done. So it is one of the type of CTMR MRI to be discussed. Okay, so it is done for pathological condition of liver conditions like liver tumor, liver abscess, fatty liver, hydrated cyst. Okay, so here we have one image that showing that different stages of liver damage. First, healthy liver, then fatty liver, then fibrosis, hardening substances, cirrhosis, and it is the damage of liver cirrhosis, cancer, death of cells of liver and converting into different form. So it is the cancer. So for all this type of in the liver tumor, liver fibrosis, liver cirrhosis, liver cancer. Okay, the investigation of the required amount of investigation is USG. Okay, but the investigation of choice I already told you that MRCT, a TP MRI. TP, CT, or TP, MRI, TP, MRI. Okay, this is the very important thing. In the liver abscess, so we discussed here liver, different types of tumor. Here we have liver abscess. Liver abscess means is the normal liver cell in that. This is the liver, another cell which is damaged, arteries, veins. Here we have the abscess and here inflammation. The liver abscess is as pus-filled mass in the liver that can develop from injury to the liver or an intra-abdominal infection. So any injury to the liver, okay, or any condition, the infection enters into the liver is cause abscess. Abscess is one of the cell. It is filled with pus. Okay. For the all types of abscess, what is the investigation of choice? CECT. CECT abdomen. Okay, it is the best investigation of choice for liver abscess. Another condition, pathological condition, we already know that the already shown you that is fatty liver. What is fatty liver? Okay, what fatty liver means already liver store fat in the liver. Liver will store fat in its areas. But how we can call fatty liver? Because we will call fatty liver, it is extra amount of fat is storing in his parenchyma. Okay, parenchyma, lean liver cells, extra amount, increased fat content in the liver parenchyma. So that's the reason we are calling fatty liver. So in the fatty liver, we have grade 1, grade 2, grade 3. Okay, depending on the severity. So what does the patient have to do to reduce the taking of cholesterol, fat, oily substance, okay, which are leading to increase in fatty liver. Okay, this is the investigation of this is the liver. Another one is we are going to discuss about in the there are liver pathologies. So the most common type of diseases we discuss. To in the gallbladder, most common types of pathologies are seen as gallstone. Gallstone are very common nowadays. Okay, so basically, it is a pain in the right upper quadrant. It may be related to liver or gallbladder. So gallstone, also known as cholelithiasis. Gallstones, also known as cholelithiasis. So cholelithiasis are of two types. One is cholesterol type, and another one is pigmented type. In the cholesterol type, it is the imbalance of bile composition or improper gallbladder emptying. Okay, so what will happen? Liver is sending the bile juice. In that, amount of fat is increased. Amount of fat is increased. So it is entering into the gallbladder. Why it is entering into the gallbladder? Because for concentration to increase his power for digestion. Bile juice is utilized in small intestine for the digestion of fatty food. Whatever fatty food we ate, so that food is digested in the small intestine. So basically, bile is secretion in liver. So in that, the amount of fat is increased. So when it is storing in the gallbladder is concentrated. When the concentration is happen, it will become the form of gallstone. And we are not eating on the time or excess amount of cholesterol we are consuming. So these are the reasons behind the gallstone. So the color of the gallstone is yellow green color. If we mix yellow green color, how it will look? It will look like. Next is pigmented stone. It is the excess of bilirubin. Due to the excess secretion of bilirubin, it is stored in the gallbladder. So that's the reason. It is the pigmented stones. So color is black or brown. Okay. So this is colitis. So we have to treat that patient that by dietically, okay, and as well as medically. Both treatment needs lifestyle modification. So it is lifestyle modification treatment needed here. Next, most common disease of gallbladder is disease of gallbladder polyps. Gallbladder polyps. So what happened? It is the gallbladder. Okay. In that you have empty space. It is the inner lining. It is the outer lining, inner membrane, outer membrane. So inner membrane, some sort of plaque you can see. It is a mucosal lining, mucosal lesion. Okay. Mucosal, it is polyps. So if it will become about 10 mm, so allopathy doctor advice to do cholecystectomy, removal of gallbladder. Okay. So this is very important. So in the previous gallbladder stone, what is the investigation of choice? The investigation of choice already I told you USG abdomen. Okay, because it is gallstones are made up of cholesterol easily you can detect with the help of ultrasonography. Okay. Next is gallbladder polyps also. Investigation of choice is ultrasound. Or we have another scan if the patient have chronic cholecystitis. Okay. Not gallbladder polyps or gallstone or related to the gallbladder. We want to know exact what is the reason. That is HIDA scan. Like in liver, we have one special scan MRT, MRCT. Here we have another special scan that is HIDA scan. Okay, this is very important thing. We have to remember this. Okay, next, the most common gallbladder problems we are able to getting down that is adenomyomatosis. It is gallbladder adenomyomatosis. What will happen? It is also related cholesterol, but it is the inner lining. We have external lining, inner lining. So inner lining, the amount of deposition of the cholesterol will increase. It is may have two causes. I told you that due to the increase of fat in the liver. So the excess fat, it is accumulation in the bile. So the bile is going to enter into the gallbladder. So gallbladder have to be the increase in concentration. So during concentration, the it is converted or stored in the gallbladder itself. Okay, it is the inner lining. It is inner lining. Like this, it is local adenomyosis, one place. It is in the two place. We will call annual, and we have segmental. A large amount is affected. In the diffuse, entire gallbladder is affected. So adenomyosis is the accumulation of fat or cholesterol on the wall of internal layer. So that's the reason in the ultrasound you will get deposition of wall thickening of GB or GB gallbladder. Wall thickening means inside the wall there excess amount of fat. So there's the reason when you are going to scan, it will get that excess thickening. Okay. So these are the main common diseases of liver and gallbladder. Okay. So in that, what is the investigation of choice? So adenomyosis is, if it is normal, we have the first investigation of choice ultrasound. In that only you will get the know of thickening. What is the thickening? Whether it is any irregular thickening or any problematic thickening, infective thickening. Okay, what is we have to diagnose about that? So you need to see CECT sometimes. Okay, that is contrast. So in that you will get to know whether the thickening is normal or abnormal according to the image. Okay, so these are the liver and gallbladder pathologies. So important scans we discussed. Okay, but in the radiology of liver, we need to do MRTP. TP is nothing but triphase. I already told that arterial phase, venous phase, and delayed phase. These are the three combination we'll get in the scan. Okay. So this is all about in today's class. Any doubt regarding that? Kindly ask. Understanding, sir, all the concepts.
Yes, sir. Yes.
Yes, sir. Yes,
Mm,
sir.
okay. So all are no doubt, no downing the investigation of choice. In which disease we have to do investigation of choice, and what are the important scans? Like today we got two new scan names. Did you listen about those scans? MR,
Yes, sir.
CT,
No, sir. First time this time.
TRCT, and TRMRI, triphase, and HIDA scan. Golden scan, we will call HIDA scan is a golden scan to diagnosis gallbladder problems like mostly acute cholecystitis, cholecystitis, and cholelithiasis. Okay, because to know the exact how much amount of stones are present and any inflammation is present. Okay, so thank you. Today is discuss liver and gallbladder. Tomorrow we'll discuss pancreas. Okay, pancreas pathology and radiology. What are the important investigation of choice? What are the diseases, pathological diseases? Okay, we'll discuss all this tomorrow. So thank you very much for joining. Bye.
Thank you, sir.